All right, good afternoon, everyone. We're going to go ahead and get started this afternoon. I know that we have several slides to cover, so I'd like to be respectful of everyone's time and get started. I want to thank everyone for joining us this afternoon on our the Medically Integrated Dispensing Solutions quarterly educational webinar. So we're very excited about today's content. We have Scott Watkins, Senior Manager, PSAO Services, to help us present some material for you guys today. Today, we're going to be talking about the 2024 Part D final rule and how to learn how your medically integrated dispensing program can prepare for the upcoming DIR changes for next year. I know we're all anxious and a little excited about the changes. So again, thank you for joining us. My name is Andrea Hughes, and I'm a National Account Manager on the Medically Integrated Dispensing team. So we'll go ahead and get started for you guys here. I would like everyone to know that the webinar is being recorded. So if you are a Vital Source member, it will be uploaded to our Vital Source members only website. Also, the Q&A is open. So if you guys have any questions you'd like to ask throughout the presentation, feel free to type those in the Q&A and we will get to those towards the end of the presentation. So again, thank you all for joining us. Special thank you to Scott for helping us present today. So we're going to go ahead and get started. So this is the agenda for today's webinar. We're going to talk a little bit about the 23 versus 24 experience. We're going to talk about the projected impact and then how to prepare for the impact. So again, thank you, Scott, for joining us, and I'm going to let you take over.
Thank you, Andrea, and good morning or good afternoon, everyone, depending on what part of the country you're in. As Andrea said, my name is Scott Watkins. I am a senior manager with Cardinal's PSAO team. I've been with the team for about 10 years in various roles. I recently took this role in strategy and business development. About 3 years ago. Before that, I was actually one of our lead PBM contract negotiators. So I'm very familiar with DIR and how it affects pharmacies and medically integrated dispensaries as well too. So today we'll just be reviewing what it currently looks like, which I'm sure everybody's familiar with, and then what it will look like moving forward on January 1st, 2024. And we'll talk about what we think that projected impact will be as well too, as well as some of what the PBM response to this ruling was as well. We can go to the next slide. Thank you. So right now in 2023, what your experience with in the Medicare space with a PBM or payer who has implemented a performance program involving DIR is basically pharmacy or a medically integrated dispensary adjudicates a claim or submits a claim to PBM for adjudication. That claim is paid with a paid response, excluding the DIR amount. And then when that payment gets remitted back to the pharmacy, that is where DIR is deducted in most cases. There is, a unique case out there with CVS Caremark that takes that on a trimester basis. So that's 3 8-week periods throughout the year. But what's really changing with this is the definition of negotiated price. So negotiated price, in a sense, or just, to simplify, is basically just a price that's available to the beneficiary at point of sale. So right now, the current definition, which is changing in 2024, it includes basically all pharmacy price concessions, so discounts, direct or indirect subsidies, anything passed through at point of sale. But what it does exclude is anything that can't be reasonably determined at point of sale. This is where PBMs have designed these performance programs where a DIR amount, a full DIR amount is not taken out at point of sale because it could be rebated afterwards if certain performance measurement period. Or in the case of CVS Caremark, it's a sliding scale where the higher performers pay a lower amount than the lower performers. So they have designed these programs to state that these are coming out post-adjudication because we can't determine the final amount at point of sale. Next slide. So moving forward, that 2024 experience, the definition of negotiated price has changed. The big change is that reasonably determinate clause has been eliminated. And basically, just to simplify the term, what it's going to say now is that the point of sale reimbursement, which is negotiated price, will be the lowest possible reimbursement inclusive of any DIR amounts. So what that means is that what you're getting paid when a claim adjudicates is the lowest possible amount. And if there's any adjustments on the back end or on the remittance level or after the contract year closes, they can only be positive adjustments. That lowest possible amount or that lowest possible reimbursement needs to be available to a patient at point of sale. Next slide. So here, what's the projected impact of this? There is going to be a certain period of time where we're going to be paying out the back end of 2023 DIRs at during 2024, but our reimbursements will be lower at point of sale. So the way to look at this graph basically is the gray bars on the positive part of the x-axis would be adjudicated amounts at point of sale. The bars on the negative part of the red bars on the negative part of the x-axis would be DIR amounts. And that green line would be a pharmacy's cash flow. This is just sample data. This isn't anybody's actual data. It's just, kind of directional for us. But what you can see is throughout 2023, there is some predictability in cash flow on that green line. So, it dips every time a Caremark trimester report hits. So that's March and April, July and August, and then again, November and December. But what we're really concerned is that first 4 months of 2024, where all your price concessions now will be pushed at point of sale, and that point of sale reimbursement will be lower. So where we're particularly concerned is that first half of January, and then again in March and April, when CVS Caremark will take out their third trimester report, or their third trimester of DIR. So that's DIR for CVS Caremark September through December of 2023 will be deducted in March and April of 2024 while you're being reimbursed less at point of sale. There's several things that, we have educated to do this. I know that Andrew will be going over as well too. But again, it's really that first half of January and then March and April is where we're concerned. Next slide. So what was a PBM response to this new ruling? We basically divided it into 3 buckets. The first one is pretty simple. 2 major PBMs, Optum Rx and Elixir, who have historically had heavy DIR programs, heavy performance programs, have decided to basically nix their clinical performance for next year and possibly re-implement in 2025. So what it means with that bucket is that what you get paid at point of sale is your final payment. There is no opportunity for a post-adjudication negative adjustment or a post-adjudication bonus payment. The next bucket is what we anticipated, and I think it was pretty universal across the industry, we anticipated PBMs would go to, and this is going to be a payer or PBM funded bonus pool. So performance will still be measured, adherence measures like diabetes, cholesterol, hypertension, and statin use in persons with diabetes. But if you perform well, you would strictly get bonus payments. And that is how some PBMs responded. The measurements at this time are not clear. We're just starting to get those performance programs in. The measurements are clear, but the payments for these bonus payments are not clear, but we're just starting to get what we call those performance programs or network protocols in from the PBMs to find out how much money is actually out there. And the third bucket was something that was kind of a curveball for the industry, and this again was pretty universal, is that the pharmacy, a pharmacy funded or a provider funded bonus pool. So a pharmacy funds the performance program. So basically a portion of their payment would go into a bonus pool, and the high performers would get, at the close of the plan year or measurement period would get a higher portion of that bonus pool, and the lower performers would not get any back. The way some of the contracts were structured is that it's not evident that this bonus pool contribution has to be visible and available to the patient at point of sale. And we anticipate that some contributions will not be. Again, it will be exactly what happens on 1/1/24 is yet to be seen. But once these network structures hit the market, we work with various trade organizations like NCPA and HTA. We do know that, we communicate with them with what we're seeing in the field. And, they in turn work closely with CMS. And if we go to the next slide. Shortly after those network structures hit the market, CMS did release a pretty strongly worded letter or message, to various PBMs, payers, providers across the industry. And I won't read this whole quote to you, but what I want to pay attention to is the last 3 lines there. It's the maximum possible reduction in payment must be treated as a pharmacy price concession and reflected in the negotiated price at the point of sale and reported to CMS. So again, we saw some, I don't want to, for lack of a better term, some funny business where maybe not all those concessions will be available at point of sale, but CMS is standing very firm on this. So we feel personally, if anybody tries to implement this, that there could be repercussions for that PBM or that health plan. And then this is just an example of what a performance program looks like currently in 2023. This is a very evident one. I'm sure most people on the call are familiar with it, but this is a trimester-based performance program. So the way this works is there's 4 months of applicable claims, and there's a defined performance measurement period where those adherence scores and MTM completion rate percentages are calculated. And then there's a 2-month period for performance calculation. And then again, 3 times a year, there'll be DIR collected over an 8-week period. So trimester 1 is in July and August, trimester 2, November and December, and then trimester 3 is the following year in March and April. Moving forward to 2024, this is what we're seeing some of these performance programs look like. There is still a defined period of applicable claims, a defined calculation period, but not all those red boxes are not DIR deductions. Those are bonus payments. So with this particular program, 5 times throughout this contract cycle, there'll be bonus payments available, and the measures stay relatively the same, right? So it's adherence measures like we talked about, MTM completion rate, as well as formulary compliance as well too. So this is a change that we anticipated, and how a lot of the PBMs reacted is that, yes, you still need to pay attention to adherence scores and your performance adherence scores and MTM completion rate, because not only are you going to miss out on that revenue from MTM and the increased fills for patients being adherent to their medications, you would also miss out on those bonus payments as well. So performance will still matter moving forward even with the elimination of post-adjudication DIR. And then this is just an example of something that we've released to our PSAO members. It's posted on our open enrollment landing page. We have various other resources out there like a PBM response document and a best practices guide, but this is one that has really resonated with our membership. This is basically, I'll read the title to you. It's the 2024 DIR Transition Cash Flow Calendar. There's a lot of information on here, when claims will adjudicate, plus when the DIRs will come out, when there'll be some overlap. What we're really directing customers to is that bottom line, that overall cash flow impact. And again, pointing to, the number 1 and number 3, those are the areas where we feel that pharmacies or medically integrated dispensaries will be pinched the most for their cash flow, because again, those point of sale rates are going to get deeper, but you're still paying out some DIR on the back end of 2023. So this is one where we've really tried to educate all of our membership on this, to really familiarize yourself with it, and again, prepare for that pinch in cash flow as a sense when you're paying out those DIRs from 2024. And with that, we'll see. Are there any questions, Andrea? I wasn't paying attention to the chat. Does not appear.
We don't have any right now, but I do want to remind everyone before we move into this last section of the presentation, if you have any questions, feel free to put those in the Q&A, and Scott and I will answer those as they come up. But moving forward, we're going to talk about, thank you, Scott, for that first part of the presentation. Now we're going to discuss a little bit about how to prepare for the impact for 2024. So this first slide here just kind of reiterates what Scott's already discussed earlier in the presentation, as far as what we're going to see with the 2024 experience and the pharmacy impact. The big focus is, the fees at point of sale. So the pharmacies, medically integrated dispensaries will know the minimum amount they will be reimbursed per claim. So that's really the biggest thing and the primary focus here. And then now I'd like to talk about a few resources. If you're a LeaderNet member and part of our membership, we have a Medicare open enrollment page that you guys all have access to. And I just want to go over a few of these quick resources. If you have not accessed them or looked at them, I recommend that you log in and do so. But number 1 is our 2024 Medicare 101 guide. That was released, I think, about 3 weeks ago now, maybe a month ago. So if you haven't taken a look at those contracts for next year, I recommend that you log in and do that. Also, another important one to mention and point out on this page is the 2024 DIR transition cash flow calendar, which Scott just discussed previously in his slides. So if you want to take a look at that again, that resource is also available here. We also have a best practices guide. So if you haven't looked at that, I highly recommend that as well. And this is kind of the login landing page. So when you log into this website, it's cardinalhealth.com/open enrollment. If you need help accessing it or need your credentials, please reach out to one of your account managers and we'll be happy to help you access that. So just preparing for 2024, like we said, if you're a LeaderNet customer, we highly recommend that you log in and look at those resources, review those contracts, reach out to any of us with any questions that you have. So stay vigilant and connected, like these webinars we have, trying to give you as much information that we have. And again, just communicate with your PSAO, review those contracts, ask questions if you have them. Review your independent contracts for 2024. So those that don't necessarily fall underneath the LeaderNet umbrella, just pay close attention to those and how they're outlined. And anticipating cash flow needs, which is what Scott discussed earlier as well. We really want to focus on that first quarter of next year. That's where we anticipate the most cash flow disruption, especially in March and April, when those CVS retroactive fees are going to be deducted as well. So those are just some things just to look out for and prepare. If you guys are using the Pioneer RX dispensing system, a lot of you utilize the DIR alerts or DIR estimates currently. So towards the end of the year, we're going to instruct you to delete those out of your software because as of January 1st, you will no longer need the estimates. So if you have any questions regarding that or whatnot, feel free to reach out to us, but we will be sending reminders and instructions on how to do so. And then lastly, I have here just to reach out to your MIDS account manager with questions. Just stay connected and reach out to us if you have any questions or concerns. I know we're all anxious and excited to see what January is going to bring. Again, thank you to everyone who spent the time with us this afternoon and joined us for our quarterly educational webinar. Again, special thank you to Scott for presenting the first part of our presentation for us. And I hope everyone has a wonderful afternoon.